Gene Powell Pasture Mowing, 629-2440. In addition to our pasture mowing service, we also offer fence row spraying and stump grinding services. Now is the perfect time to get ahead on your weed control and to take care of those troublesome stumps for an overall pleasing appearance. Gene Powell Pasture Mowing, 629-2440, or online at powellgene@yahoo.com. We are licensed and insured. Gene Powell Pasture Mowing, 629-2440.
Ocala's information station, 1370 WOCA. Ocala.
All right, 25 minutes before 10 o'clock. Thank you for tuning in. Yesterday, my son took me out to a restaurant for Father's Day, and he took me to a restaurant that is a restaurant I normally don't go to. In fact, I think I may have been there once before. But anyway, they sell healthy choices, and I had a healthy choice item, and I thought, oh gosh, my son actually is smarter about this stuff than I am, and he's 31. His dad, that's me, 62. So, maybe I need to clean up my act a little bit about what I eat, what I put in my body, or maybe not. Dr. J.N. Cohn is on the phone. He's a professor of medicine at the University of Minnesota Medical School. He's the director of the Rasmussen Center for Cardiovascular Disease Prevention. He holds a number of patents on devices and drugs used to diagnose and treat cardiovascular disease. He has been honored for his research accomplishments by the Heart Association, the American College of Cardiology, the American College of Physicians. The credentials go on and on and on. And he's written a book called Cardiovascular Health. Here's the part that I think you're going to find interesting, how conventional wisdom is failing us. So maybe I could have had a slice of bacon on my sandwich. I don't know. Let's find out from Dr. Cohn. Good morning, doctor. How are you?
Good morning, Larry.
Where are you calling from?
I'm calling from Minneapolis.
All right. And you've done this because you're a surgeon. You've seen the inside of people's hearts, correct?
Well, I'm not a surgeon, but I certainly understand the workings of the heart.
Oh, okay. So what is it that, well, am I right, first of all, that I'm understanding the material that was sent to me, that you don't necessarily think that poor eating leads to poor cardiovascular, or am I wrong about that?
No, I think you're right that we've overemphasized the role of behavior, diet and exercise in the cause and treatment of heart disease.
All right. Yeah.
The disease, it's a biological process. The arteries and heart change as we age, and the rate of that change and aging is largely determined by the genes. It runs in families. You've inherited genetic factors that influence the rate the blood vessels and the heart age. So that, yes, you can modify that. And if you eat a bad diet, if you smoke particularly, if you get fat, if you don't exercise at all, you may modestly change the trajectory. That is, the rate of aging may either be increased or decreased by what you do. But it's mainly your inheritance which determines whether you're going to have a heart attack or a stroke before the age of 100 than it is what you eat and what you do. And, of course, you can alter that with a number of drugs that we use that slow progression of that disease in the arteries and the heart. And that's where we fail the American people, because we've kind of led them to think that if they eat well and exercise regularly, they're not going to have heart disease. But that is not true. We can't eliminate it by diet and exercise. We can by drugs if you have the inherited factors that will lead you to early disease. So that's my message.
All right. I have so many questions about this. So how do we know where we stand? Like, how do we know genetically where we are so that we can better understand the direction we need to take?
Well, that is, of course, the important question. Is there a way to identify what your personal risk is. Half of American people, American adults, will die from cardiovascular disease. This is not a minor illness. This accounts for half of the deaths in our country. And what you'd like to know, of course, is which half you're in. Are you in the half that's going to... And there are a number of methods that have been employed over the years to do that. The most important one that's been used is measuring risk factors. And the media and the health agencies are full of recommendations about risk factors, blood pressure and cholesterol. And it is true that those risk factors do bear a relationship to your risk, but they don't separate clearly those individuals who are at risk, the half who are at risk and the half who are not. We believe in measuring early disease, since heart attacks and strokes occur from progression of early disease. If you can find the early disease many years before that would otherwise cause a problem, and we can treat it effectively, then we can protect people until they reach the age of 90 or 100, which is our goal.
Really?
So the approach in our hands is to measure the early disease, find out whether you as an individual have early disease, and get you treated if necessary to protect you through your whole life.
Okay, I'm going to use a seesaw as a way to ask this question. If you measure me, for example, and you determine that I've got, lots of leeway, then I could eat bacon or whatever, and it would not tip the scales against me. But if
yes.
I'm just trying to guess. But if using the seesaw, you measure me and I'm right in the middle, then I could tip the scales in my own bad favor or whatever, or in my favor if I don't eat, let's say, and so I could tip the scales if I was close to the middle. Is that am I right about my kind of? I'm trying to put it in layman's terms for myself.
Yeah, well, in theory, you're right. In practicality, all the attempts that have been carried out, very robust and expensive trials carried out to document that if you change your diet and change your exercise and lose weight, you will live longer, you will have less cardiovascular disease. Unfortunately, most of those trials have failed to demonstrate a significant influence of doing those things on outcome. And it's troubling because we are out promoting good health habits as if we know that they will favorably influence you, but the data don't support that. The drugs that we've used do reduce risk of heart attack and stroke, but diet and exercise hasn't proved capable of doing that.
Yeah, I definitely want to come back to the conversation regarding the drugs. That's probably the main thing to talk about. But real quickly, before we do that, the reports that we hear that certain segments of the Earth population have different health issues or lack of health issues because of their lifestyle.
Right.
You hear the Asians have different, and not the Asians living here, so it's not necessarily genetic, but it is lifestyle. The Mediterranean diet, they say. You hear all these things. Are they true?
Well, they are true. There are population differences, but it is impossible to really know whether those population differences are the result of the environment or the genetics. And it's very difficult. For instance, behavior patterns are inherited, so that identical twins who are separated at birth maintain the same habits of lifestyle.
Isn't that something?
Even though they've never been together. So the genes are driving a lot of this. Yes, I do believe, and we all believe, that you can modify this with environment, and you're quite right that you can tip the scale a little bit by changing your diet. Certainly by smoking, you tip the scale profoundly toward disease. Getting fat probably tips the scale modestly. eating a slab of bacon probably doesn't have any long-term adverse effect, but if you do it every day and you're eating poorly and eating too many carbohydrates or eating the wrong kind of fat, you may tip the scale. But we've overemphasized that, and I think the public, therefore, has become convinced that all they have to do is eat right. And exercise regularly, and they're going to be fine, and that is not correct. If they've inherited the gene, they better do something about it.
Dr. J. N. Cohn is our guest. He's written a book called Cardiovascular Health, How Conventional Wisdom is Failing Us. You have another piece that you've written. It says here it's a scientific memoir titled Saving Sam, Drugs, Race, and Discovering the Secrets of Heart Disease. You've been doing this for a long time. 750 scientific papers that you've been honored for. So what do you say to the doctor who says to you, all right, you're offering a drug, but I'm offering a lifestyle change that will avoid the drug. What do you say to that doctor?
I think the mistake is that the lifestyle does not substitute for the drug. Doing both is the best guarantee of prolonging your life. And the drugs don't substitute, lifestyle doesn't substitute for drugs. And it isn't either or, it is both, because the biological process is influenced by the drug therapy, regardless of whether it's genetic or environmental. So the drugs cover the waterfront. The exercise and diet may not.
After we come out of the break, I wanted to ask you if you could perhaps share with us some success stories, some people who you've treated, and how it has actually helped them. So let me take a little break, and we'll be right back. If you have any questions, by the way, you're invited to call. Dr. J. Cohn is with us. He'll be with us for the rest of this half hour for about another 12 minutes when we come back. The book is called Cardiovascular Health, How Conventional Wisdom is Failing Us. If you're a doctor and you haven't heard about this, then maybe this is a learning opportunity for you as well as it is for us lay people. All right, we'll be right back with Dr. Cohn.
The weather is brought to you by myfwc.com. Safe boating is no accident. A mix of sun and clouds with a heavy thunderstorm moving from the coast to inland for the afternoon hours. The high 83 to 87, and a shower thunderstorm in the evening tonight, a low 74 to 78. Tomorrow looks rather cloudy. Again, a shower thunderstorm, especially in the afternoon inland, a high of 86 to 89. Shower thunderstorm for Wednesday, high 86 to 90. From the Florida Weather Center, I'm meteorologist Maggie Johnson.
The Coke 0400. It's where valor meets velocity. It's where celebration meets acceleration. All American meets absolutely amazing. At the Coke 0400, powered by Coca-Cola, Saturday, July 1st. Kids 12 and under are just $20, including free UNOH fan zone admission. Guarantee your seats at 1-800-PIT-SHOP or DaytonaInternationalSpeedway.com.
Veterans are the foundation upon which our freedom is built. Listen to The Source, WOCA, each Thursday at 9 a.m. to Veterans News with Hank Whittier from Vets Helping Vets. You'll hear tributes, information on veterans issues, and stories that will make you laugh, cry, and feel proud. Veterans News always focuses on the military, past and present, and on our first responders. Veterans News is brought to you each week by Bob Wine's Camellia Gardens and Nursery, keeping you blooming since 1952.
If you find an animal or a bird that needs help, call Animas Foundation at 352-843-6379. They will come and get the animal if you can't take it to them. High school students and those with court-ordered community service can earn required hours in this rewarding environment. And veterans who share a bond with animals and parents who have been through mental or physical trauma are especially welcomed. Families, clubs, and tourists can arrange for tours of Animas without driving for hours or miles. Consider volunteering. Animas needs you. Here is your 30-second news brief. The man accused of shooting a nurse in the leg at West Marion Community Hospital has been identified as 38-year-old Jason Ronald Gignac of Summerfield. A sinkhole opened yesterday at the east entrance to the Paddock Mall on Southwest 27th Street. A Florida Highway Patrol sergeant was hit and killed in the line of duty Saturday evening in Alachua County. President Trump is urging Governor Scott to run for the Senate, and American Idol will be holding auditions in Orlando in August. And that is your news brief from The Source.
Next Generation MD is the future of healthcare now. Listen in the first and third Thursday at 10 a.m. to learn how the future in PRP treatments are here in our area. Find out the many ways that Dr. Juan Jordan, MD, Charles Brooks, NP, and case manager Mark Shaw have brought the family medicine practice to a new level. Hear from the very people that benefit from the fine work they have done in this field. Next Generation MD every first and third Thursday at 10 a.m. here on WOCA 96.3 FM, 1370 AM, The Source.
All right, 10 minutes before 10 o'clock, 79 degrees, temperatures climbing to 86 today with a 45% chance of rain. Let's return now to Dr. J.N. Cohn. His book, again, is called Cardiovascular Health, How Conventional Wisdom is Failing Us. Dr. Cohn, thank you for waiting through the break. Let's talk about some success stories that you might be able to share with us.
Okay.
Do you have any?
Well, there are a couple of early experiences which convinced me that what we were doing was right. We have a sort of poster girl for our program who is 100 years old and was photographed by the Wall Street Journal because of her longevity. She's a lifetime smoker. She wouldn't even put her cigarette down to be photographed for the Wall Street Journal.
Oh, my God.
So here's a person who did all the wrong things for 100 years and doesn't have disease because she didn't inherit the gene that would have caused it.
Okay.
We have another example. In our early days, a young reporter came to our program to write an article about what we were doing. Because it was innovative at the time, and it still unfortunately is because it hasn't been adopted widely across the country, although we do have programs sprouting up in various cities. But this young woman who was in her 30s was a vegetarian, a long-distance runner, a skinny young woman who looked fit and healthy. And we put her through our program, which she had asked to go through, and she had remarkably advanced disease of her blood vessels, which implied that she was going to have a heart attack at a young age. And we said to her, we don't know quite what to tell you. You didn't come in here to be evaluated. This is just part of your research to write this article. And she said, well, I'm not surprised. I have a terrible family history. All of my relatives have died early of heart disease, and that's why I've been living this lifestyle of exercise and diet and vegetarian foods. And yet, despite all of that, here she had advanced disease and needed treatment.
Wow. And
so those are the two wide distributions of how genetics plays a role.
Now, for the second example, did the drugs help her?
I have not seen her since then. She was not a local person. She came in to write this article. We haven't followed up with her at all. So I can't report on what happened, but we have been monitoring many people who we see who have advancing disease based upon our testing. And we've put them on drugs, and they've come back, and their scores have markedly improved, and their blood vessels and heart have gained health. So we feel confident that we're doing the right thing when we treat people who have early disease.
I may not know what you're saying when you answer this, but what is the drug?
Well, there are a number of drugs that are in widespread use. They're generic. They aren't expensive. They should be given away free to get people to take them because they are really saving healthcare dollars by keeping people healthy. The statin drugs are important ones. They do lower cholesterol, but more importantly, they protect the artery from the disease process that leads to heart attacks and strokes. There are a number of blood pressure lowering drugs, which are very effective in protecting the arteries. Drugs like ACE inhibitors, angiotensin receptor blockers, calcium antagonists. These drugs we use not necessarily to lower blood pressure, but to protect the arteries.
Okay.
We also have a group of drugs that work to protect the heart from progressive disease. So the drugs are there, and we need better and more of them.
All right, let me ask you this. It's a two-part question. Are the drugs derived from natural sources, like plants or whatever? And if so, could we just have a diet that had those plants or whatever whatever the natural sources are?
Well, the drugs are not derived from plants. They are manufactured, but they take advantage of naturally occurring mechanisms. For instance, red rice is basically a statin drug. It's in rice form, and the problem is that we don't know how much of it you need to eat, and we don't have data on it, but we do with the drugs which contain the same chemical that exists in the red rice. So there are a lot of examples of drugs which have the similar effect as natural foods, and the foods we don't have good data on because nobody has carried out studies.
Now, one of the drugs that we hear all the time that's, I guess, controversial in some ways, but we hear it's good for us, is aspirin. I mean, that's a simple, common drug that's supposed to help us with heart disease. Are your thoughts on that the same as conventional information that we've been getting for the last couple of decades?
Well, that's a very important question because aspirin is an entirely different drug. As the artery wall thickens and disease progresses, clots can form on the wall, and it is not the process of artery wall disease, it's a superimposed clot because of the blood that flows through the artery. Aspirin protects from the clots. It doesn't protect from the disease in the artery wall. So if you have disease in your artery wall and you're not treating it effectively, aspirin can protect you from the heart attack and stroke, which is caused by a clot, not by the underlying disease.
Oh, I see.
So it's a totally different process, but it is protective in certain individuals who are not otherwise being effectively treated.
Okay, so as a layperson, if I were to read the book Cardiovascular Health and really absorb what you're saying in it, and I had an issue with cardiovascular health and went to the doctor, would I be able to persuade him or her to change my treatment based on what I'm reading in the book?
Well, that's a very insightful question, and one that I can't answer. We have some doctors in our community who are strongly advocating what we're doing, and they refer patients to our center to get evaluated. We have others who don't believe in it and are not pursuing what we're suggesting. I think there has to be a national movement to recognize the importance of early detection and effective therapy. And I can't tell you that you can go to your doctor and get the appropriate response right now. I hope they will understand this as we proceed to get the idea out. Really?
Is there anything you can leave us with regarding, like, could I go to the health store and buy product A and it'll help me, or is it not that simple?
Well, there is a movement afoot, a very prominent movement to give everybody over a certain age, like 50 years old, what's called a poly pill that has a little bit of all the drugs in it that I've mentioned, with the idea that heart disease is so prevalent that it's 50% of the population that's going to die from a cardiovascular event, right, that the whole population should take a pill. And that's the attitude of the poly pill community.
Gotcha.
That hasn't been widely accepted because it needs to be under medical supervision, and you don't want to treat half the population who don't need the medication. But that shows you the whole idea that this is something that needs to be established throughout the whole community and not just in a few individuals.
Well, we've heard about resveratrol. I guess it occurs naturally in grapes. We've heard about what's the other red thing in watermelon? I can't remember what it's called. But we've always heard about these things that you could take from a health food store or eat them naturally. I'm interested in reading the whole book. How do I get the book, Cardiovascular Health?
Well, you can get it on Amazon, as most books are on the Amazon carries the book, and I encourage you to read it and spread the word.
Well, great information. It's definitely food for thought. Dr. J. N. Cohn, thank you so much for being on the air with us today.
Larry, thank you for having me on.
You're welcome. We will be right back.